Hello and welcome to another episode of Daily Remedy Podcast. Today we're with Milissa, former tennis star athlete, and now an executive at a regional agency. And with that, I'd like to welcome Milissa. Thank you for joining us.
Hi, thank you for having me, Doctor.
Sure, let's begin with the start of your story. Can you talk a little bit about your tennis career and how you eventually became a chronic pain patient?
Sure. Gosh, I've been playing sports probably since I was 10. I focused in on tennis about 12, so a lot of hard work and dedication. I always had the drive to wanting to play in Division I tennis on a scholarship, and I was fortunate enough to be able to accomplish that goal. Had several injuries while getting there, mainly in college, and also I played about a year and a half on the professional circuit. Ended up having to retire because I had, at that point already, I had 4 knee surgeries, wrist and shoulder, I believe. There was many, and a very, very bad back. I had ruptured a couple discs in my back as well. So that's kind of how it all started. In short, I guess it's been a process.
You mentioned the quality of care you received as an athlete was vastly different than how you were treated after your athletic career. Can you talk a little bit about the care you received as an athlete and then afterwards and what the differences were?
It was pretty significant difference. I would imagine being on, I guess in hindsight, full scholarship, playing in a varsity sport. They did take good care of you. But they did also want to make sure that they were getting their money's worth, I guess, and get you out playing as quick as you can. I do think I was put back out way too soon after a couple different surgeries. Especially after my second knee surgery, I was having a very hard time recovering because I was back on the court within a couple weeks, and I was arguing quite a bit with our trainer. Because my knee was so incredibly swollen, had to be drained a couple times, but yet they're still taping me. This is the point they were taping and bracing. Just things like that had happened where they definitely kept you going, but they did good medical care, but I do think they pushed it too far, or I think some other injuries could have maybe been prevented had I not been put back out so soon. But it really was the care afterwards that was traumatic. I definitely think I have some PTSD from the medical procedures that were done to me. I was told so many different things. I was too young to have so much pain. I was too pretty. I looked too good to not be in pain. There's no way you can be in this as pain by looking as. And believe me, I don't think I'm any stunner. But their words just escaped my imagination by telling me I looked too good and I couldn't be suffering from the pain that I was in, even though I had MRIs, x-rays, everything to validate what I was feeling. I couldn't understand the logic, and not to be sexist, they were male doctors. I don't know if it had anything to do with it, but I was definitely treated differently, and I for the life of me can't figure out why. I can't.
So, as an athlete, you were treated one way. As a former athlete, you were treated a different way. But
Absolutely.
They must have had your medical records. They must have known what you have gone through. So, why do you feel like there was a difference in the care you received?
Doctor, I learned young to work through pain. It was kind of like my parents' motto, you work and you got to overcome things. And even doctors to this day, I think I maybe briefly explained earlier, I have a knee surgery that I just had in October that's gone completely awry, to the point where I had MRSA infection and some other things where the doctor said, because the MRSA wasn't diagnosed until almost 4 months post-op, and I was septic at that point. It's a long story, but I'll never forget the doctor saying that you put on this face of no pain, no anything. I don't know how you were not in the hospital or how you got through this to this point with how you did. And I'm like, I think I'm just used to, you fake it, you learn to fake it and to get through, because people don't want to hear about your pain. They don't want to hear about how miserable you are. I lost a lot of friends in my 20s. I mean, I had a hospital bed in my own house. I could not get out of the bed by myself. So I was, sick enough for them to prescribe a hospital bed for my home, but not sick enough to prescribe medications, only procedures, only dozens and dozens and dozens of procedures that cost me a fortune as a single person, that did nothing but seem to make things worse. And I can't it still baffles. It's something that weighs on me so heavily, doctor. I can't tell you. It's like I said, I do think, I hate to use PTSD because I almost think that should be reserved for combat veterans or something, but it's something, because it's such a trigger for me, and it's me keeping it cool right now is really hard because I feel like breaking out in tears. You know what I mean? It's really hard to go back and think about. Very difficult.
You talk a lot about being almost forced, or at least strongly encouraged, to get a lot of procedures, either instead of prescription opioids or in conjunction with prescription opioids. Talk a little bit about those experiences where you felt like you were strongly geared towards procedures that you knew wouldn't work, yet felt like they were imposed upon you.
I mean, I've had so many. I had monthly trigger point injections where I was getting up to 20 injections all throughout my spine and lower back area. I was getting nerve ablations. I was getting epidural injections. One that put me in the hospital because they tore my spinal sac, so I had a spinal fluid leak that was significant enough where when they put me in, I was in for a week, because my parents had told them they didn't want a resident doing that procedure. They didn't listen. Had a resident do it. He punctured the spinal sac. The headache was probably one of the worst things I've ever experienced. And then they went in to do a blood patch. Instead, they put a second hole in there. It was a nightmare. But I think one of the worst things that I went through that didn't make any sense whatsoever when I had an MRI that clearly showed I had herniated discs that were pressing up against the nerve root endings. I had severe stenosis already in my 20s from playing at a young age and training at what you have to do at a young age to get to that level. They suggested intervaginal injections, pelvic injections, and I'll never forget sitting there and with these two or three doctors, and one of them looked at me, who wasn't my main doctor, and he looked at me dead square in the eyes like I should have took to me it was like, get the hell out. It was just that knowing look that this wasn't right, and I didn't know what to do. I was young, at that point I would have tried anything to relieve the pain I was in, even though this to me sounded absolutely absurd. He kept insisting that it was pelvic pain. I'm like, I don't understand. It's not pelvic pain. I'm not having pain in my abdomen. It's not in my hips. It's in my back, where you can clearly see where these herniated discs are. I don't know. I have other things I believe about this doctor that I will not say, but those were the worst things I've ever experienced. It was like, I almost equate to being raped. I know that sounds so awful, but you have him in there with a couple other doctors. They had to have a nurse. Literally, they didn't do any anesthetic, nothing for anxiety, nothing. And I had a nurse. They actually had a nurse laying on top of me. It was so incredibly painful. These injections, I think I got 6 of them. It was a torture. I've never experienced anything like that. And I'm screaming, I'm crying, and my dad's out in the hallway yelling because he could hear me. My mom is in there saying, what are you doing to her? And she's like, this cannot be right. And how in the hell is this helping her? And God, it was just awful. And I could not physically walk on my own for a good, I don't know, week and a half. And that has traumatized me. It has absolutely traumatized me. And none of it made sense. And I remember him calling me saying that he wanted to drop me as a patient because nothing seemed to be working. And I'm like, nothing seems to be, all you've done are these thousands and thousands of dollars procedure. But at this point, they weren't prescribing. They wouldn't give me any opioids. They would only give me nerve, I think, what's it called? Neurontin. I think it was Neurontin was the drug of choice then. They did not want to prescribe any opiates, even though when I was getting opiates off and on, I could function again. I could actually live some kind of a life, but I think this was in the beginning of a lot of the heck coming down on prescribing opiates. I'm assuming that's what it had to be, but I was on so many different medications, a Flexeril, all these million different things besides an opiate, that all it did was either put me in a stupor and I wanted to sleep, or it did nothing. It did nothing to help relieve the pain. And that same doctor who I mentioned, who looked me square in the eye in that meeting before we tried those pelvic injections, he ended up calling me and said, you need to get out of here. Like, this is not the place for you. You've got to find another doctor because this isn't working. And in so many other words, he told me to get out, like find somebody else. And wow. I heard he ended up getting dismissed from the practice about less than a year later. He was at a different practice. In fact, he called me when he started his new practice. I was already with a different doctor at that time, but I still stay in touch with this gentleman because the fact that he did that and probably risked his job doing that to me meant a lot. It meant the world to me that somebody there understood that I was getting screwed around with, that I felt like a used guinea pig, that they were going to try a million different things instead of prescribing medicine. It just didn't make any sense at all.
Now, for many people, it may be difficult to understand the pressure of a clinical encounter when you're strongly encouraged to get procedures, when prescription opioids will work, if not more effectively, enough to avoid the trauma and pain of injections. Talk a little bit about how you tried to ask your physician at that time for prescription opioids and how they would respond.
Oh my gosh, it was awful. It was like they treated me like I don't know if criminal's the right word, but they were almost gobsmacked that I was asking for it. And like the times at Ohio, the times where I was playing at, where meds were prescribed, or even past that after my surgeries, always seemed to help. I'm not saying it never takes the pain away. It never has. It takes the edge off where I can at least function as a human, have some kind of quality of life, where I can work, I can have a social life again, I can function. Even though most nights I come home, I'm on my heating pad, and I don't do much of anything, but at least there's times where I have enough energy and the pain's adequate enough where I can do other things. They were almost incredulous of me asking, and they got like a smirk. Well, why do you think that those are the only things? I'm like, I never once said that's the only thing that's helping, but you are taking away and not prescribing the one thing that does seem to help. Like, I don't understand it. I wasn't in there asking for hundreds of pills. I was asking at that point 20 for a month, anything, something to at least not let me get out of bed in the morning without sometimes having to call my parents to help get out of the hospital bed. Like, I couldn't physically do it. That's how much pain I was in. And it made no sense. My parents took me multiple times to the ER because I would have massive swelling in my knees or in my lower back. Sometimes it went down into my lower buttocks. And even in the ER, they were hesitant to prescribe opiates. And my dad's like, what is wrong with you guys? Like, why are you not going to give her the one thing that's going to help relieve her pain? And like I said, I think this was when everything was heating up with the prescription opiates, and I think I was a casualty of that, as many, many millions of other patients have been.
This must have been incredibly stressful for your parents. Talk a little bit about the conversations you would have with your parents about how you were being treated.
Well, they saw a lot of it. I was fortunate enough. Mostly my mom was my dad worked. He had big time job where he couldn't take off as much time. My mom at that point, she was a nurse, but she was a stay-at-home mom at this point. And if I didn't have them, I don't know what I would have done. I really don't, because they had to help me so much, whether it's driving me to and from appointments. There were times where my back spasms would be so bad and the leg pain would be so bad I'd have to pull over. I think I mentioned before one instance I was by myself and I had a really bad attack, so to speak, and pulled over on the side of the freeway, and a cop pulled up minutes later and asked if I was drunk. I'm like, no, I'm not drunk. I'm having very bad back and leg pain, and I pulled over because I was really worried I wasn't going to be able to drive anymore. I just needed to take a break and put my legs up for a few minutes, and then I'm going to get going. And after he talked to me, he obviously knew I wasn't driving, and he was very kind and offered me a ride home and leave the car there. And I'm like, no, I don't want to leave my car on the freeway. I just need a few minutes to gather myself. And he actually was very kind and sat behind me with his lights on until I was ready to roll. And very gracious. But my point is that these things happened where I just didn't know when it was going to happen. So I did have to rely on them quite a bit, and I was grateful for their support because they saw it. They saw me vomiting after these epidural injections. My dad sat in there when they were doing the trigger points. He's like, "You're doing so many, and her back looks like a dartboard, but yet you're not gonna give her anything for the pain. This doesn't make any sense. Like, what? Help me understand this." And they just say that we're not fans. I'm like, "You're a pain clinic, but you're not fans of prescribing pain medicine." It didn't make any sense at all. I can't explain it. I can't explain it to this day. And I was fortunate enough that my dad knew an anesthesiologist that at one of the major hospitals here, and he also treated pain patients. And he, when my dad told him everything that had happened, this was after they did the intravaginal injections, and my dad was just furious at what happened. And he ended up taking me on, and that man changed my life. He absolutely changed my life. He this is what he does. He treats the pain patients at the cancer center here. I don't know what I would have done if he didn't come into my life. I mean, honestly, there were times that I was contemplating other options. It was not worth living life the way I was living. It just was. There wasn't a life. There wasn't a life to live. It was awful.
Yeah, it can be very tough. This new physician who understands you and was more willing to listen and understand your medical conditions, can you talk how those clinical experiences went? What was the nature of the conversation? How did they go?
He actually sat and listened to my history. There was no judgments. I had everything transferred to him. What I had, unfortunately, a lot of my records got lost at the university. So what I did manage to have, and also he had, through what my parents had told them about, which was, I think the combination, he knew what, I think the biggest part is that he listened and he understood the actual complex of my injuries were so severe. He couldn't, my back is so badly burnt and scarred from my heating pad trying to just get some kind of relief. And it's like, no one's going to do this to their body if they're not in pain. He just understood, and he looked at everything collectively together, the amount of surgery. At this point in my life, I've now just had my 22nd surgery in October. It's insane. I can't tell you that day changed my life. I was able to live life again. I mean, he understood it. And I think the other doctors, I think maybe because they were in a pain setting, clinic setting, so to speak, I found out afterwards that there was a hard mandate from the university to stop prescribing opiates altogether in the pain center. They were supposed to refer people either to the spine center, somewhere else, and they were just going to be seeing the patients and deferring them to different departments, which makes absolutely no sense. Why have a pain center if you're really not going to treat pain patients? You know what I mean? It didn't make any sense. But anyway, this doctor, he looked at everything as a whole versus the one-offs, and I think that's what made the difference.
Yeah. Let's talk about where you are now. So you are gainfully employed, you're an executive at a regional agency, you're doing quite well for yourself. One might say all's well that ends well, but for you and so many other chronic pain patients, there's a lingering difficulty, to put it mildly, from everything you've had to experience. Can you talk about how those past experiences and past memories affect you today?
Well, there's a fear every month that your prescription's not going to get filled. Like every month I go through a battle with my insurance company. They actually force me to reduce. So I'm not even on a third of the dose that my doctor has recommended. They only approved a little under a third from what I was initially taking. And they changed that about, 2 or 3 years ago. So it's obviously impacted my pain level. That's a lot. That's a big change, going from being pretty much out of control to reducing it by 2/3, only because a board at some insurance company decided it was too much. And if you look at the scope of what I'm taking, it's not. I mean, compared to what I've seen if other patients are taking, I have no idea what the why or reason, and they have filed multiple appeals to have them to try to change this, because it has affected my quality. Like I said, most nights I am home on my heating pad, and I'm lucky if I'm out once a month, twice a month, socially. It's just sometimes not worth it. But I feel bad. I mean, I feel bad even saying that, because I'm fortunate enough to have some relief. It takes the edge off where I can function and I can go to the office, and my work is pretty. It's involved, and I have to travel a lot. There's a lot of shooting involved. There's travel all over the world, actually, and those are really, really tough on me, and they suck the life out of me. But kind of what I grew up with, like I said, you have to just suck it up and do it, I guess. But I am fortunate, because I know many other people don't have at least what I'm getting, even though mine's even cut to a third. So I feel blessed that I'm even getting some. I'll take anything I can get, because I cannot go back to where I was. I simply can't.
Talk a little bit about your relationship with your insurance company and your physician. Clearly, your physician wants to care for you, understands your pain needs, but your insurance company is providing certain pressures both to your doctor and to you. Can you talk a little bit about how that relationship works out, and how this kind of amorphous third-party entity is effectively determining how you talk to your physician?
My physician says it's one of the worst part of his job is dealing with insurance, because I'm not the only one. There's other patients that this happens to, and every month, even though I get an approval that this is a prescription, prescribed amount at this dose, and it's supposedly approved for 6 months, 3 to 6 months, depending. There's 2 different medications I'm taking. Every month they flag it. Every month my pharmacist has to go through this whole rigmarole of getting prior auth yet again, even though I have a prior auth in my hand that they've mailed me saying that it's approved. It's a nightmare. So every month it gets pushed back 2 or 3, getting it filled gets pushed back 2 or 3 days, sometimes longer. So if I'm not even taking what I have every day, because I have to sparingly use it in case I don't have anything for those 3, 4, or 5 days it's going to take to get it approved. And my doctor tries to do everything. He's written letters, he's done phone calls, he's done whatever he can do, and there's some bogus board that has one doctor running it, the rest are non-doctors. This board or group of people, I don't even know how many people it is, gets to decide who gets what amount, and it makes absolutely no sense when you have a doctor validating and providing all the validation as to why you need this amount, but yet this group of people that one doctor is a part of makes that decision without even seeing me, without even, I don't know how they're making that decision. I don't, and I don't understand the bureaucracy involved. I don't know how that they can interfere with my direct doctor's orders. It makes no sense. None. I'm fortunate that he even goes to bat for me. A lot of doctors, because mine is monthly, they have to do these prior auths monthly, and it's exhausting. I'll take in desserts and stuff to the nurses sometimes because I know what a headache they have to go through with me every month with them. And I thank God that they're so kind, and they're always so gracious with me, and they say it's not your fault, it's their fault. And I just kind of lucked into a very good team, and I'm so fortunate for that. But I'm still suffering a lot of pain because I'm not nearly at the dose where I should be. But you have to live with what you got, I guess, and that's kind of where I'm at.
For those who may be listening and learning how to navigate the clinical encounter, can you give some advice on things you've learned, tips you've picked up to effectively communicate with your physician, with your insurance provider?
I think I will not, but I also think it's having effective communication with the pharmacist. I keep the pharmacy team involved in everything that's going on. Whenever I have a surgery come up, I let them know when I'm having procedures. They've obviously talked to my doctor's office many times, almost monthly, getting these prior auths done. I think keeping the pharmacy team in the loop has been probably more helpful than I think almost anything else, because they aren't questioning my intent. They're not questioning my use of the meds. And they have knowing my history as I'm going. And I do think that helps. And I do stick with one pharmacy, and if they don't have it, they order it. And so I have been, there's times where they can't get it in, and that's not their fault. But there's a lot of people that I've met online, through Twitter support groups or other social media groups that I know a lot of people have a hard time with the pain contracts. And I'm sure you're familiar with them. You're basically signing your life away on these things, and you're agreeing, you have to agree to drug tests and all this other stuff. And did I want to sign one of those? No. I mean, it just seems so dehumanizing. It's just insane, some of the verbiage that's in these pain contracts. But my doctor was very straight with me and said, look, my hands are tied. I've got to have these things in order to keep these groups of people off my back, and this is the only thing that's going to help me keep doing this. And it was either that or nothing. I could not go back to living how I did in my 20s. It wasn't a life. It was the worst 10, 15 years of my life. I can't go back to that. So I signed it, and a lot of people, I think they wear as a badge of honor that they won't sign it, and they're not, therefore doctors won't see them, they won't get their prescriptions. Maybe I'm a weak one, I don't know, but I could not go back to that. So I did sign it, and I just abide by what they asked. And he has the right to drug test once every quarter. He doesn't. I usually just get drug tested once a year. I've never had an issue. I don't know about other patients. I've heard some get done quarterly. At this point, I don't even care, because I don't do anything wrong. I don't take illegal substances. I don't drink. I don't do anything like that. So drug tests away. At this point, I just don't care. I just can't. I just know what it was like beforehand, and I don't want to live like that. Mm-hmm. So at this point, I'm gonna do whatever is gonna maintain me living somewhat of a life. So open communication, I think, as honest as you can be with your doctor and your pharmacist, I think, for me, has been successful. Does that make sense?
Melissa, Makes perfect sense. In the remaining time that we have, for those who are listening and may want to get a hold of you and speak with you directly, is there a way that people can get a hold of you, either through social media or something else?
Yes, I am on Twitter. Gosh, I think I'm at m. Oh gosh, I can pull it up really quick and tell you what my Twitter handle is if that's okay. I don't remember I've had it for
Not
so
a
long. I
problem.
don't
We can
remember
also
my
put
own.
it in the link at the bottom.
It's at MISWOJO1. Is probably the easiest way to
Got it.
connect with me.
Perfect. And so, Melissa, thank you so much for your time. Appreciate it and look forward to staying in touch.
Thank you so much too. I appreciate your time. Appreciate you having me on your show. Take care.